Welcome back to East Texas Now's newest vet project segment. Guys, I want to introduce a new local vet to the desk, maybe not to you pet owners out there. I have the pleasure of please welcoming Dr. Noor. Dr. Noor, happy to have you here on the East Texas Now desk.
Hello, thank you for having me and letting me speak about this subject. I appreciate it.
Absolutely. I'm glad that we also have one of Dr. Noor's pups over here. She has an impressive number back at home, but we met Moose, and Mr. Moose is the office mascot, if you will, today. My new best friend. I have instantly fallen in love with him. But there's a lot of questions regarding pet owners when it comes to specific heart diseases in dogs. So is it cool if we talk about that?
Absolutely.
Awesome. Okay, so let's get started first. We know that your office actually in particular has been dealing with an increased amount of heart disease cases, specifically in older dogs. So can you talk a little bit about exactly what you've been seeing in your experience?
Right. So heart disease, doesn't necessarily have to be a particular age, but like you said, certainly we do see it more often in older dogs. There has been lots of studies and, estimated data collected, and almost 1 in every 10 dogs will have heart disease. So we certainly see lots of patients all year round. And most commonly, we do see older dogs, smaller breed dogs with what's called mitral valve disease. So it's the left-sided heart disease that we normally see. And then in younger dogs, we do see things like, heartworm disease, which is one of the main things that I like to talk to my clients about. And then in larger breed dogs, we'll see things like chamber enlargement, specifically dilated cardiomyopathy. But most of the time it is mitral valve disease. And a lot of times we are able to catch heart disease pretty early on if we do annual exams and we're listening to the patient and we pick up on a heart murmur. Heart murmur is just turbulent blood flow within the heart. So anytime we listen to a dog with a stethoscope, and if we hear a swoosh sound, that typically means that there's something going on, but that doesn't necessarily mean the dog needs to be on treatment right away, but certainly something that we need to monitor. And then, in other cases, we do have patients coming in for already coughing and breathing problems, and those patients are already in congestive heart failure, which also can be managed, but it is a little bit harder.
Absolutely. Now, a couple things from what you just said there. You explained it so well. Older dogs are more susceptible to heart disease, right? Mm-hmm. When we say older dogs, what's that threshold?
So actually, there is a study out there that says approximately 85% of dogs by the age of 13 will have heart disease. So most of the time we start seeing it by age, 8 to 10, but by 13, 85% will have them. So just older.
No, that makes a lot of sense. Mm-hmm. So when we say older dogs and how prevalent it is, we're talking very much older, 13 and up.
You got it.
I'm only asking because my dog is 7, and I'm like, maybe that's something. But that's something that my vet is probably going to check for on the annual exams then, right?
Exactly.
And so what are, let's start with like an annual exam. You said the whoosh, right? That's something that you sound, and that's something that then can be treated and prevented before they start showing symptoms. Now, say maybe there's moving, maybe they don't get into the vet for a few years, things of that nature. What symptoms are people going to recognize at home that might mean, hey, you need to get to the vet and talk about heart issues?
Right. So the most common heart clinical signs that I hear about is coughing, increased breathing or rapid breathing, and difficulty breathing. Sometimes they can have lethargy, weakness. They're unable to exercise like they normally would. Like if your dog walks a mile every day and all of a sudden he's not wanting to walk a whole mile and, taking a few steps, sitting back down, that can indicate that their heart is overworked. So all of those signs can be related to heart disease. And in particular cases, right-sided heart failure can lead to fluid accumulation in the abdomen. So sometimes people will tell me that their dog is bloated, but that's not actually bloat, that's just fluid accumulation in the abdomen.
That makes a lot of sense. So we've gone over the age, we've gone over symptoms to look out for. Now, are there ways to prevent the disease? And is some of it just genetic? I know that, with age, you said about 85% of 13-year-olds, but leading up to that, is there something that we as pet owners can do to kind of set them up for the most success possible?
Right. So, as far as there's different types of heart diseases. So, diseases like heartworm disease, you can certainly prevent it. All you have to do is keep your pet on heartworm prevention, and that can, reduce lots of complications in the future. As far as mitral valve disease, the old dog heart disease, that is more so a degenerative process. So, just like osteoarthritis, patients will develop, the thickening of the mitral valve over time, and there's not necessarily a preventative measure to it. But as long as you're taking your pet in for annual exams, picking it up early, managing it early, monitoring it early are the key things that you can do for your pet.
Makes a lot of sense and probably calms the fears of a lot of pet owners that it's not something you have to specifically ask for to be checked with your vet, correct?
Right.
That's just something done, the checklist that already built in annually. But say you get, a dog that maybe you pick them up from a shelter, maybe they were in a dire situation and you're rescuing them. Those are really good side effects to know what's happening. Hey, we need to get them in as soon as possible. Well, in terms of anything regarding heart disease, what do you want the pet owners out there on East Texas Now to know?
Right. So my main recommendation is just making sure you take your pet in for annual exams, and listening to their heart is part of almost every vet's physical exam. So they are going to listen to your pet's heart and pick up on a murmur. The other thing is just keeping on top of your heartworm prevention. That's really, really important because heartworm disease can be very challenging to treat, but it's super easy to prevent. And then just monitoring your dogs at home, monitoring their weight, appetite, coughing, things like that. Just staying vigilant. So.
Yeah, absolutely. I think a little more over there, or little Moose. There we go. Little Moose over there is saying he also needs to know extra treats is what he wants the East Texas Now viewers to know. Give all of your dogs all of the extra treats today. Well,
Some
Dr.
pup cups.
Absolutely, all of the pup cups. Dr. Nord, thank you so much for joining us here on East Texas Now. Don't be a stranger, and Moose is now part of ETN, so you lost.
That sounds great.
You now
Thank you
have
so much.
only 14 dogs. Guys, we will be right back with more news, more national news coverage here coming up. Next week, same time, same place, and next vet segment. Stay tuned. You're watching East Texas Now.